Hello and welcome. Today's discussion will be in another contagious viral illness, that is mumps, which mostly affects the children. This is a self-limiting benign condition, but sometimes it may be associated with complications. So today we'll see in detail regarding mumps. Mumps is an acute viral illness which is characterized by painful enlargement of the salivary glands, especially the parotid as a presenting sign. The parotid gland is most affected. As I said, this is self-limiting and this is a vaccine-preventable disease. Epidemiology. Mumps is endemic all over the world, with the peaks of epidemics are noticed every 2 to 3 years, especially in areas where the children are not vaccinated. And this is more noticed during winter and spring season, and then where the places are crowded. The etiology, the agent of mumps is mumps virus, which is a single-stranded RNA virus belonging to genus Paramyxovirus and family Paramyxoviridae. And there is only one serotype of this virus. Host, man is the only reservoir of this infection, and all age group, any sex, any race is susceptible, especially if they are not vaccinated or they never got the disease before in their life, then they are highly susceptible. The common age for mumps is 5 to 15 years, with peak being 9 years. And always there is in any viral illness, there is a maternal protection up to 6 months. And carrier state does not exist. The incubation period of mumps is 14 to 25 days, with the average 17 days. The transmission is highly with the salivary secretion, and then beside that respiratory droplets, cerebrospinal fluid, blood, direct contact, airborne, fomites and urine. These are other mode of transmissions. The period of infectivity is 2 days prior and 5 days after appearance of parotitis. And once you acquire this infection, you get a lifelong immunity. Now let's see the pathogenesis. The virus enters through the mouth-nose, proliferates in the parotid and the respiratory mucosa, enters the regional lymph nodes and invades the blood, leading to viremia, and the target organs for this virus is salivary glands, central nervous system, pancreas, testes, heart, liver, kidney, thyroid gland, joints, where they produce different types of symptoms. The symptoms, 20 to 30% cases, the infection is subclinical. That means they are asymptomatic. And in the symptoms, it starts with the prodromal phase like any other viral illnesses. Here also there is a prodromal phase where the child has fever, headache, nausea, neck muscle pain, there is malaise and there is loss of appetite. This is followed by acute illness where there is a salivary manifestation. So here there is a tender parotid swelling in 30 to 40% cases, and the parotid swelling is bilateral in 75% cases, but sometimes in around 25% it can be unilateral also. And this swelling occurs, or this acute phase is after 48 to 72 hours of fever. Other salivary gland involvement is also there in around approximately 10%, but maximum it is parotid. First, there is pain near the earlobe. Then there is difficulty in swallowing and chewing. And it is very painful and tender, and the child is very irritable at this time. The swelling gradually increases in 3 to 4 days, obliterating the angle of the jaw. The swelling fills up space between posterior border of the mandible and mastoid. This is the posterior border of the mandible and till mastoid. So this area is all swollen. Then it extends downwards and forwards this side. So look at the picture, downwards and forwards, and it pushes the earlobe upwards and outwards this way. So it extends throughout. Then there is edema of skin and soft tissue obscures the margin. So this swelling is obscuring the margin, so there is no well defined margin in case of mumps. Swelling looks big, but if you go to palpate, you cannot find the margin. That is because of the edema of skin and soft tissue. So it is said mumps is seen better than palpated. So from far you can see a big swelling, but when you go to palpate you get nothing. So it is seen better than palpated. Then comes the recovery stage. In the third stage, it is recovery stage. So here acute condition subsides within 72 hours. Fever gradually subsides in 3 to 5 days, but the parotid swelling, it stays till 5 days, or it may take as long as 10 to 14 days to subside completely. It starts subsiding by 5 days, but to subside completely it takes at least 10 to 14 days, so 2 weeks time. Now the differential diagnosis of the parotid swelling. This is many times asked in exams. You even get in short cases. So the swelling or the differential diagnosis for parotid swelling will be lymphadenitis in preauricular region. Other viral parotitis besides mumps can be HIV, cytomegalovirus infection, influenza, parainfluenza, Epstein-Barr virus and Coxsackie virus. So mumps is not always, the parotid swelling or parotitis is not always due to mumps virus, but it can be due to these other viruses also. Another differential diagnosis is Staphylococcus aureus leading to acute suppurative parotitis. Another is non-infective parotitis occurring in SLE, systemic lupus erythematosus. Then calculi instansens duct is another differential diagnosis, and lymphoma and leukemia in some cases. Diagnosis for parotitis is clinical, but since there are other viruses also and other conditions also which may lead to parotitis or swelling like that, so best is to do some investigations. So viral culture is gold standard. This can be done in the saliva, in the secretions like saliva, cerebrospinal fluid, blood or urine. So any sample you can isolate the virus. This is a gold standard if you can do that. So in the figure you can see this baby carrying the model of virus. And then beside that you can do serological test where you detect the IgM antibodies. If it is positive, it is significant, and IgG titer, if it is 4-fold rise, then that is also diagnostic. Then if you do the complete blood count, you get a leukopenia with relative lymphocytosis, and serum amylase may be raised many times because pancreas is another structure where mumps virus is targeting. Coming to treatment, there is actually no cure for mumps, but the care focuses on comfort of the patients. That means you do the symptomatic treatment. So initially you need to isolate the child till disappearance of the mumps. That will be around 10 days because it is a contagious disease, so it might spread to other people. So you isolate the child or don't send the children to school. And then the other treatment will be symptomatic supportive, so bed rest, antipyretics for fever and pain, and then diet, you give soft diet so that it is easy for the child to chew and swallow because that part is difficult, and you need to give good hydration. Then local support and bed rest for orchitis. Orchitis is one of the complications, so if it occurs then you have to give a local support and bed rest. NSAIDs steroid is given for 2 weeks for arthritis, orchitis, those are complications. So all complications you treat accordingly as it comes, but actual management for mumps will be just symptomatic and supportive. Complication of mumps is important till 8 to 9 years of age. That is the peak age for mumps to occur in children. So till 8-9 years actually complication is none. Very rarely you will see the complication. They will not have any complication. Beyond that age there is chance of complications. Starting with the central nervous system complications, aseptic meningitis is the most common CNS symptom. So many times aseptic meningitis is even considered as a extrasalivary manifestation of mumps. 50% patients are showing asymptomatic pleocytosis only in the CSF. Only 15% are symptomatic and they present with the clinical features of meningitis. Another complication will be meningoencephalitis, which is very rare. If it occurs, it is serious. So this one will be having acute onset, and there can be late onset immune mediated acute disseminated encephalomyelitis, which is also serious condition, so the intervention should be in time. In time intervention will show good recovery. So this is meningoencephalitis, which is rare, but if it occurs it is quite serious. So you have to watch for these symptoms. Other CNS complications are cerebellar ataxia, facial nerve palsy, auditory nerve damage, Guillain-Barré syndrome, transverse myelitis. Other complications are orchitis, epididymitis, epididymo-orchitis in 25% cases, and testicular atrophy can occur in 1/3 of them, but sterility is rare. Number 3, mastitis, oophorytis can occur usually in the postpubertal girls, and there can be acute pancreatitis in 4% cases. If they have acute pancreatitis, this may trigger the onset of the insulin-dependent diabetes mellitus. Other complications are arthritis, myocarditis, nephritis, thyroiditis, and ITP. Thrombocytopenia in any viral illness can occur. So you can see this child is having petechial rashes. Now come to prevention. Prevention is by the vaccine. So MMR vaccine at 15 to 18 months, first dose you can give. Second dose is given at 4 to 6 years or before 11 to 12 years. Prognosis, it is having an excellent prognosis, and there is the patient gains a lifelong immunity. If it is complicated with serious condition, then only sometimes there might be some morbidity, otherwise prognosis is excellent. So you have to take care of the complications. So mumps can be managed at home. It is, since it is a benign or self-limiting condition, but you should know when you should see the doctor very urgently. So if this patient or child is having persistent high fever, then you have to go meet the doctor urgently. If there is severe headache, neck stiffness, vomiting or confusion, this is another condition, you have to see the doctor. Or if the child has a severe abdominal pain or testicular pain, because those are complications. So in those situations you have to meet the doctor. Otherwise mumps can be managed at home symptomatically, just giving comfort to the child. Okay, thank you. Hope this class was useful for you. Next class I'll discuss another viral illness. Thank you.